Now here is a X-ray radiograph which is given here, and we'll have to identify the infection from the chest X-ray of the patient. The patient is having low grade fever. Okay, so here if you just try to understand it, I'll just enlarge the image here, and if you see, there is a homogeneous spread of certain small seeds or some certain small nodules throughout the. Here you will be able to see, if you just try to understand, uh, the homogeneous spread of certain radio opacities, and these are like nodule size is between 1 to 2 mm, and that's why it's not so much visible as well. So this particular pattern, these are the pinpoint opacities. Okay, so if you just see, these are the pinpoint opacities, okay, which are seen here, and these are homogeneously spreaded throughout the run on the bilateral aspect of the radiogram. Okay, and this is going to be your, these pinpoint opacities are going to be your millet seeds. We call these as millet seeds, or we call it as miliary pattern. Okay, so this radiographic pattern, along with, if it is correlated with the clinical finding, that is the fever of unknown origin, that is going to be the miliary pattern of the radiograph, chest X-ray radiograph. So let's read in the detail. Actually, if we talk about the tuberculosis, that is TB, there has to be primary infection. So primary infection basically is what? It is the infection by the Mycobacterium tuberculosis, which is going to take place for the first time, right? So that is going to be your, and then we'll have the secondary infection. Okay, so there will be secondary infection in which the patient has already undergone the infection in past, or there is a reactivation of this, and that is known as the secondary tuberculosis more aptly, right? So the secondary tuberculosis, it is a pattern of the disease that arises in a previously sensitized host. So host is previously sensitized. Okay, now what is important here is that the secondary infection can be of many types. It can be cavitatory, it can be progressive pulmonary tuberculosis, it can be miliary disease. Okay, so it can be cavitated kind of infection. Then you will see that will be having the progressive pulmonary tuberculosis, and then you can have the miliary tuberculosis. Now we are more concerned with the miliary tuberculosis, so we'll be coming to that now. So the miliary tuberculosis here, it basically occurs when organism is going to drain through the hematological route. So from the hematological routes, the organism, that is your Mycobacterium tuberculosis, is going to disseminate it to the different organs of the body, that will be resulting in small yellow white consolidated regions. Okay, so the hematological spread will be there, and that will be gone to the multiple organs of the body, that can be spleen, that can be kidney, that can be liver, and it will be going to different organs, and there it will be leading to the formation of yellow white consolidated lesions. Yellow white consolidated lesions, and this particular form of TB is known as miliary tuberculosis. So miliary tuberculosis is more prominent in liver, bone marrow. Okay, I'll just list the important names: liver, bone marrow. It is going to be spread to the spleen, adrenals, kidney, and other reproductive organs like fallopian tube and epididymitis, all that. So first of all, we have to understand there has to be certain seedless or certain bacteria, or the Mycobacteria tuberculosis foci, that has to be disseminated to different parts of the body through the hematogenous route, and these particular small bacteria, the foci, are generally known as the millet seeds. Okay, and those can be seen on the radiograph, chest radiograph as well, because there will be small foci of necrosis that will be seen here, and there will be of course the bacteria residing in that. So here you will be calling those the millet seeds. Okay, so these are the millet seeds that will be spreading to different parts of the different organs of the body, and that will be causing the tuberculosis to be disseminated to different parts of the body. Okay, so this is something which we have to understand, that this particular radiographic feature is that of miliary tuberculosis, and we'll be getting the answer. That is your third option, where you will be having the miliary TB as the option.